India's Prime Minister Narendra Modi says a COVID-19 vaccine could be ready for distribution within weeks. Healthcare workers will be given the inoculation first. Mr. Modi has met with leaders of various political parties to discuss India's fight against the pandemic. He says 8 vaccines are being tested and produced in India. That includes the vaccine developed by Oxford University and AstraZeneca. For the 5th day running, less than 40,000 new cases have been reported across the country. Ishan Garg joins us live from New Delhi for more on this story. Ishan, Mr. Modi has hailed his government's handling of the pandemic at this meeting, hasn't he?
Yes, absolutely. The government has been very pleased with the way it's handled the pandemic, especially in the past few months. I mean, if we just look back a couple of months ago, the height of the daily caseload was at 100,000 cases. Now it's hovering just around 40,000 cases. And from the government's eyes, this is a massive win. And this is despite the festive season that just went by, when the government was actually warning that the cases could rise significantly. And we haven't seen that kind of spike that was expected back then. But there are also critics who are saying that the government hasn't actually done very well. And especially on the testing front, it has performed rather poorly. The government is saying that it can test about 2 million people every single day. But despite that, it tests only 1.5 million or even close to 1.2 million people every single day. And experts say that this is being done deliberately to keep the numbers down. But there are also other experts who disagree with it. They say that a number of people could not be getting tested because they fear the stigma of testing positive for COVID-19. So there are mixed opinions on how the government has actually handled the pandemic. But the other thing that the Prime Minister said, that India is actually prepared for a vaccine, and it has the blueprint laid out in front of it, and that it has a history of delivering vaccines. That's actually is quite true, according to experts. Back in 1990s, India inoculated close to 1 billion people with a polio vaccine, which helped save millions, if not hundreds of millions of lives. So experts agree with the government when the government says that India has an unprecedented network of supply chains and logistics and storage facilities and healthcare workers when it comes to delivering a potential vaccine to 1.3 billion people.
Well, that's the question, isn't it? It is a complex process to distribute the vaccine. And you mentioned this blueprint. Did they give more details?
It is an incredibly complex process, and it involves a lot of moving parts. The first thing that the government has to do, which it says it's working on, is creating an immunization plan. So this is something that the government said in the meeting today as well, that it has got it's got a blueprint of the plan of an immunization program, which will lead towards inoculating close to 80% of India's population. Essentially, they're also forming a special task force which is going to take care of the modalities of the immunization program. But the challenge of inoculating 1.3 billion people remains huge. Experts are saying that, firstly, there are infrastructural issues to solve. One word that we are hearing very often these days is the cold chain. Cold chain facilities are very rare in India, and most of them are used for storage of farm produce and agricultural goods, and only 1% of it is actually used for pharmaceutical drugs. And as we have seen, a number of vaccines, such as the vaccine from Moderna, from Pfizer, they require cold storage facilities, as do other vaccines which are being developed in India as well. So that's one major infrastructural challenge. The second is to actually get the vaccine to people who are in the remotest parts of the country, who don't even have access to basic healthcare, for which experts are saying that India needs to actually now go on a hiring spree and hire thousands of healthcare workers, albeit on a temporary basis, which people who can go out into the remote parts of the country and inoculate these people. And then thirdly, there's the issue of the cost of a vaccine. It's entirely unclear at this point that how much a vaccine will cost. We are hearing figures all the way from $4 to about $25 to $30, and it might be very difficult for a majority of India's population to afford a vaccine if it becomes too expensive. But at the same time, the government is saying that it will inoculate most Indians for free. So there's hope there.
Ishan Garg in New Delhi, thank you.